How often is the Baker Act used here on the Sunny Coast? During the last fiscal year, more than 3,500 involuntary examinations were done in Sarasota, up more than 70% from just 4 years ago. 677 of those Baker Acts were for minors. Manatee County also had 527 involuntary exams of minors last year. Statewide, the numbers of minors Baker Acted has increased 50% over the past 5 years. And joining us for more on this trend is Lieutenant Charles Caniff of the Sarasota County Sheriff's Office. He oversees crisis intervention training for the entire county. Judge Erica Quartermain of the 12th Judicial Circuit Court, and Dr. Robert Friedman, formerly a professor emeritus at the Louis Delaparte Florida Mental Health Institute at USF. I should say you're still so a professor emeritus. And Bob, I wanted to start with you because people hear that number, a 50% increase in youngsters being Baker Acted, and they don't know what to make of it. Are there more kids who need that kind of acute help, or is it the way we compose these numbers, or what?
It's hard to tell. What's for sure is that there are many young people in distress, and many families and young people not getting the kind of help and support that they need.
More now than there used to be?
Over the years, there certainly has been an increase in that. There's been many reasons, changes in family composition, families have disintegrated. There's been an increase in youngsters exposed to trauma. For a variety of reasons, there's a higher prevalence. There's no indication, however, while there's been a generally increase in prevalence, there's no indication that over the past 5 years there's been a 50% increase in prevalence. When you see a number like that, it makes you wonder, are there some policy changes? Are there some new services that are not available? Are we now becoming more aware of the problems? Are we taking problems that were treated as school problems before or legal problems and now treating them within the mental health system? There's something going on when I see numbers like that other than an increase in the actual prevalence of 50%.
So that begs the question, is law enforcement more attuned to responding to these incidents in a certain way, or have new rules and procedures been put into effect that results in increased cases? And has there been a change in terms of how the courts handle these things? And Lieutenant, I'll start with you.
Well, I think that law enforcement is more in tune with the needs of the community. As you mentioned, I'm the lead crisis intervention team training coordinator for Sarasota County, and more law enforcement are now willing to look a little deeper and find out whether or not the behaviors that they're encountering might be tied into an underlying mental illness, and properly try and direct those persons with mental illness, keep them out of the jail, out of the court system, and get them the help they need. And that's especially true when we're dealing with juveniles.
And Your Honor, this winds up basically on your desk. And have you noticed this increase? And what do you think when you see these cases come before your desk?
Well, our jurisdiction uses a Baker Act magistrate. So while I do see parts of these cases, I do not see enough of them to say. But the numbers speak for themselves. We have to first understand what the Baker Act is and what it is not. And it is a law that is directed at those individuals who are an imminent threat to themselves or others, being suicidal, homicidal, or totally unable to care for oneself. So it is really reserved for a small number of those who are mentally ill, because...
And let me be clear here. It could get into the courts in two different ways, whether if law enforcement responds to a situation and takes its action, but there are many cases, and I have seen this, where families go to court because they have concerns about a loved one, and...
Yes, that can occur. So there are three ways. It can be initiated by law enforcement. It can be initiated by a mental health professional, like a doctor or a counselor, and it can be initiated by a family member through an ex parte proceeding. But those ex parte proceedings are relatively small. We can see they're less than 3%. The majority of them now, and we see a shift in it, is those that are initiated by law enforcement.
Let me clarify one thing, however. Yeah. The data that we're referring to is the number of youngsters for whom an involuntary exam was initiated. When we say Baker Acted, we tend to think of youngsters who are actually deemed to need the involuntary placement and placed. What we're looking at, we don't have data on precisely how many of those there are. what we have data on how many are, for how many are involuntary exams initiated.
Right. And let's also just, let people know this data is put together by the Louis Delaparte mental health program at USF, which you've been associated with for many years, and then it is given to the state for what purposes? Well,
the Baker Act Reporting Center is based at the Florida Mental Health Institute. Florida is one of the few states that gathers data, and it's provided to the state for them to monitor how well the program is functioning. However, it is basically data on the number of exams that are initiated. We don't know a lot about the youngsters who are there or what their needs are. To know why there's such an increase, we would need to know more about the youngsters and how they came to be initiated.
Right. So as you say, the data is only good as how it's gathered, and you believe that there is a variation within Florida in terms of counties that do a good job and maybe not so good job at gathering it.
Well, there's a lot of variation from county to county in the percentage of youngsters who end up with an initiation. And that's to be expected. Florida is a large and diverse state. There are about half the counties in Florida do not even have a Baker Act receiving facility there. And when you don't have it there, then you're less likely to have referrals made, because it's a much bigger effort to transport them to another county.
Right, but Lieutenant, we only have about a minute left in this section. We have seen here in Sarasota County a 42.53% increase in the number of youngsters Baker acted. Are you confident in those numbers, or what does the county do in terms of to get an adequate read of what's going on here?
Well, I think that confidence in the numbers is an unquantifiable statement as far as that's concerned. The Sarasota County Health Department tracks those numbers. Sarasota County I hate to say it, we're striving to be a good place to be mentally ill. We have several organizations within the county department, the Behavioral Health Care Consortium and the Acute Care Task Force, and we have a behavioral health care policy coordinator that gets these information and puts it out so that we can see the full scope of the problem, and they meet quarterly throughout the year.
Right. We are just getting going on this discussion of the Baker Act. Coming up, along with our check of our weather forecast, we'll be back in just a moment. Welcome back. Tonight we are discussing the Baker Act and its increasing use in Florida, particularly with minors. Our guests tonight are Lieutenant Charles Kneff of the Sarasota County Sheriff's Office, Judge Erica Quartermain, and Dr. Robert Friedman, formerly of the Louis Delaparte Florida Mental Health Institute at USF, which oversees the Baker Act Reporting Center. One of the stunning numbers that I hear about all the time is that Florida ranks 49th in the entire country in terms of funding mental health issues. And my question to all of you right now, beginning with Your Honor, is whether you see the lack of resources for families and individuals who need this kind of help basically being part of the problem.
I definitely believe that's part of the problem. Historically, although we have, as a community, come together to make changes for the future, you can liken this issue to a health issue like kidney failure. You can provide ongoing dialysis, or you cannot provide it, and that individual goes into kidney failure in a crisis environment. So when you fail to provide the ongoing wraparound services for serious mental health illnesses, then you will see an individual go into a crisis stabilization unit. It is not only more expensive to deal with it that way, it is very traumatic for the person to continue to go into these types of episodes. So we have to look at it as a whole, and we have to provide treatment on a continuum. So there is a lot of movement within our community to do that, and I believe there was some short-sighted decisions made decades ago that are now catching up with us in the form of increased crisis stabilization and homelessness, to name two.
We're seeing that every day on the streets of Sarasota. But the question becomes, and I've been to the Delaparte Center at USF, and I know this is a real issue there. What kind of effort has there been to lobby state legislators to change this if it's having such a huge impact here in Florida?
Well, there's been an increase in advocacy for mental health services in general. However, it hasn't had the impact that it needs to have. We need more funding for mental health services, for sure. And as the judge points out, it ends up then that kids and families don't get the supports and services they need to keep them at home. Instead, they go into more expensive placements that are not effective. There's no research to support that these hospitalizations are effective for the youngsters.
So it costs
They're
more
needed
money.
in some cases, but they cost and are not. And then the money's not there for the services in the community to keep the families together and to keep the youngsters from needing this. So at some point, there has to be a planning process, and I'm delighted to hear there is a planning process beginning, but there has to be a planning process to look at how do we shift what we're doing? How do we begin to put more resources into the community and into the wraparound services and into a range of crisis services if we want? Because crises occur, but the best communities have 5 or 6 different options in dealing with them, and they work together to deal with them.
Well, first of all, Your Honor, have your colleagues in the judiciary tried to lobby local legislators that something has to be done, something's got to give?
Yes, I mean, I met with the legislature a year or so ago asking just for more money, period. But there are a lot of competing interests in the legislature. Where we have been effective is through grants and the generous donations of local philanthropies, the city and the county. So it's been an approach requiring a lot of entities to move it forward.
And Lieutenant, you wanted to make that point that here in Sarasota, there are community resources out not only for individuals who need the help, but also the families of the individuals.
Absolutely. One of the organizations that's prevalent in Sarasota is NAMI, the National Alliance on Mental Illness. And NAMI at its core is a volunteer grassroots organization who are looking to take care of the people that are suffering and the caregivers and their families around that, and just provide them a little bit of comfort to let them know that they're not out on an island all by themselves.
Right. What is being done out there in terms of studies locally or regionally that would give us a better read in terms of why this is happening now and what direction we should take?
Well, there is a great study that was done by Sarasota County, and it's called the Behavioral Health Acute Care System Data Review. It was an analysis of 6 months of crisis stabilization expenses within the county, and it was done really well. And I think one of the pieces that I can take from it that add to the Della Parte study, which recognizes its own limitations, i.e. we don't know how many people are actually that sick and how many people are getting treatment. But in the county study, it tells us that there are, over a period of 6 months, there were 41 individuals in Sarasota County who received crisis stabilization services, either Baker Act or Marchman Act, 6 times in a period of 6 months. So now, even though there are a significant number of them, when you dig deeper, that's 240 that are just from 41 people. Then there's an additional almost 300 people who were using those services 3 times.
So the bottom line, Bob, is does that mean that there's a lack of a comprehensive approach, maybe in Florida in general, about what to do in situations like this?
Florida has been moving towards a comprehensive system of care. Children are often the neglected part of the mental health system. Not that adults have enough resources, but for children, the problem is even greater. We know, for example, that more children are initiated for examination when school is in session. There's fewer when it's the summertime, there's fewer on the weekend. And we know that there are evidence-based interventions to use in the schools that make a difference for kids and their families in the schools. Are we using them to the extent? There's a number of evidence-based interventions that didn't exist, frankly, 10, 20, 25 years ago for children and families, and one has to take a look at how well we're doing in using them.
We have less than a minute left, but are all schools and faculty and staff trained the same way in terms of handling situations, and with school resource officers, are they all trained the same way to see a problem and deal with it effectively?
Sheriff Tom Knight is a big supporter of the Memphis model of the crisis intervention team training, and we've got it out to all of the deputies, include the school resource officers. And to that end, one of the things that we need to bear in mind, and again, Sarasota County is very progressive in its response. The Jewish Family and Children's Services have a crisis response team that deals with and does follow-ups on the children that are taken into protective custody by the Baker Act, many of them from school, to try and follow up with them afterwards to see how they're doing and hopefully get to the root of the problem and get them in the right direction.
All right, we have to take another quick break, but when we return, we'll have final thoughts from our guests, plus what some of our viewers are saying about funding for Planned Parenthood. Stay with us. Welcome back. Over the past 5 years, the number of children who have been involuntarily examined under the Baker Act has increased by 50% statewide. We have seen that increase right here on the Suncoast as well. What should we make of these changes? Our guests join us right now for final thoughts. And Lieutenant, what do you think viewers should take away from this?
I think viewers should understand is that law enforcement responds when a crisis situation is occurring, and the resources available to both the person and their loved ones, their caregivers, the family, have been overwhelmed. Law enforcement is not going to take the loved one into protective custody unless the criteria is met.
And sometimes people don't understand that.
And that's very difficult to get across. Is a lot of times the family and the caregivers understand that if Charlie is having a bad day, what's going to happen potentially, but we can't always act on what they know is going to happen potentially. So we have to go with what we've got there. And I'd like to get that out and also understand is that the training that the sheriff supports, we're looking to slow the situation down and err on the side of caution and take someone into protective custody to get them the help they need, because we don't have that knowledge of who they are and what they've done. And
Your Honor, I've seen this, and when it gets to the court, that some families may be seeking help for their loved one, but if it doesn't meet those parameters, it's not going to happen in terms of involuntary Baker Act.
That's correct, but you also see the family come forth in criminal cases where there is sort of a desperation because there are no services available, and now this sick person has ended up in the criminal justice system, and that's one of the saddest things that I see.
And Bob, one of the most frightening part of what you have said is that in terms of the increased pressures on our youngsters and our youth, and that they're dealing more now with things more now than in the past.
Absolutely, absolutely. I just want to say that it's unfortunate that in Florida and across the country, we continue to put a disproportionate amount of resources and attention on the crisis stage and on residential care, on expensive interventions that have not been proven to work. And to the extent that we continue to put a disproportionate amount of resources there, we're ensuring that the youngsters and families are not going to get the supports for when the problems first develop, when they're still young, when they're more amenable to effective intervention. We're ensuring that the problems are not going to get better, but are only going to get worse over time.
But we live in tight budgetary times, and people only really spend money when it's a crisis.
Well, I'm encouraged that Sarasota is taking a look at its system, and hopefully we'll be able to do better. I'm encouraged that even our data show that that the 7 counties in Florida that had the highest rate of examinations, involuntary examinations, all went down in the past year. So while there's been a big increase over 5 years, it seems to have stabilized and seems to be even getting a little bit better.
All right, we'll have to leave it there. But before we go, we want to share with you what some of our viewers are saying about last night's topic, federal funding of Planned Parenthood. Past efforts by Republicans to defund the organization were vetoed by President Obama, but with Donald Trump preparing to take office, the organization could lose more than $500 million it receives each year from the federal government. Here is what some of our viewers are saying. Nina Powers writes, no funding cuts. Planned Parenthood is the women's health provider for thousands of women, from cancer screening to birth control, especially in underserved areas where there is no other health clinic available. When I was young and working a job without health insurance, Planned Parenthood provided me affordable medical treatment and health care thanks to their funding. Kurt Brown writes, I don't believe my tax dollars should be given away to anyone. Planned Parenthood should be run off donations. I am tired of being forced to pay for everyone's stupid decisions and mistakes. If the people want to help there, donate, don't force me to. And David Lee Howells writes, I understand that there are passions on both sides of the fence concerning Planned Parenthood. I feel they do, on the whole, far more good than harm. Well, if you'd like to join the conversation about tonight's topic, just visit our Facebook page at facebook.com/news7. And FYI, want to watch past Roundtable discussions? They're available on Apple TV, Amazon Fire, and Roku. Thanks to our guests for being here tonight. Lieutenant Charles Kniff oversees crisis intervention team training for the Sarasota County Law Enforcement. Judge Erica Quartermain is a county judge for the 12th Judicial Circuit Court, and Dr. Robert Friedman is a professor emeritus for the Louis Delaparte Florida Mental Health Institute at the University at South Florida.